Hi everyone, my name is Tanisa, and my investigation looked into reviewing existing literature about the risk factors and complications associated with the use of peripherally inserted central catheters and totally implantable venous access ports for cancer patients. So I'd like to start by introducing what these devices actually are. Peripherally inserted central catheters are long, thin, central venous access devices used to give medical practitioners access to veins in order to administer medicines such as chemotherapy and immunotherapy. They are commonly inserted in a peripheral upper arm vein, as you can see in the image on the screen. They facilitate both inpatient and outpatient chemotherapy, so they're accepted as a pretty convenient and accessible device. Totally implantable venous access ports are also devices used frequently for chemotherapy amongst other medical purposes, but unlike PICCs, these devices are composed of an injection port implanted into the innermost layer of the skin and a central venous catheter fed directly into the relevant blood vessel. One of the major advantages of this device is that it allows for patient activity, as these ports don't need any external dressing and the necessary maintenance for them is quite infrequent. So you may be wondering why investigate these two devices. Although safety concerns with these two devices are said to be pretty infrequent, there are still complications that arise through their use. Awareness of these risk factors and complications is crucial to maintain the quality of patient care. So the main aim of this review was to compare and contrast the risk factors and complications that emerge when using these two devices, but a couple of subsequent aims include assessing the suitability of each device for cancer therapy, and then revealing further areas of investigation that arose from the research. The papers studied in the review were found and selected when I searched for open access research related to each device's risk factors and complications, but specifically for cancer patients. I limited the search to studies from within the last 10 years to account for the most recent developments and findings available. This led me to identify 7 main studies for analysis and evaluation. So let's start by highlighting the key risks and complications associated with the use of PICCs. The two studies I will be focusing on for this section are both retrospective studies conducted by Tao et al. And Mjelk et al., although a few others will be mentioned. So in the study by Tao et al., the main risk factors identified were drinking and prior surgery history. Immunotherapy, for some background information, enhances the body's immune system by allowing it to identify, target, and eliminate cancer cells. Mjelk et al. Found that for oncological treatment, administration of this therapy could be identified as an independent risk factor. They also discussed that tumors of the pancreas, brain, and stomach corresponded with increased rates of thrombotic events and highlighted that the significance of the diameter of the catheter in relation to these thrombotic events could not be ignored. Risk factors identified in other studies that were not explicitly mentioned in these studies include age, BMI, and low levels of physical activity. Moving on to the associated complications with this device, Tao et al. Found that the complications with the highest incidence were phlebitis, which is inflammation of the innermost layer of the vein, and thrombosis, which is blood clotting in the vessel. These were associated with drinking specifically. Similarly, Mjelk et al. Identified local inflammation, deep vein thrombosis, and occlusion, which is blockage of the blood vessel, as complications associated with PICC use. Both Tao et al. And Mjelk et al. Identified infections as a high-frequency complication, namely bloodstream infections. Mjelk et al. Stated that these occurred less frequently in outpatient settings compared to inpatient settings. And aside from these complications, bleeding and mechanical issues were also identified. So I considered several different factors when evaluating these two studies. Firstly, Tao et al. Did not consider the lumen size of the PICC lines used. On the other hand, Mjelk et al. Clearly identified that the incidence of thrombosis increased depending on this variable. So by not having this variable considered, the results in the Tao et al. Study were severely impacted. Both studies were retrospective analyses, which is when trends and patterns in information that has already been collected from the past are identified. They make use of convenient sampling when collecting data, and therefore by nature are liable to bias. They also lend themselves to more correlation-based relationships. Additionally, Tao et al. Had a much higher sample size compared to the study by Mielk et al. Tao et al. Also performed their investigation on multiple centers, whereas Mielk et al. Conducted a single center study. This may indicate that the former has more representative data and conclusions to offer. However, Mielk et al. Focused their study primarily on oncological patients, whereas Tao et al. Performed their study on patients with PICCs regardless of their condition. This may explain why their sample size is much larger and suggests that their study may not be specific enough to be applicable to cancer patients only. So now we'll move on to totally implantable venous access ports. I'll be focusing on 3 studies by Yu et al., Wang et al., and Bassi et al. In a study by Yu et al., patients with breast, lung, and gastric cancer had higher rates of complication incidence compared to other malignancies. Contrastingly, Wang et al. Identified hematological, head and neck, and gynecological cancers. While Yu et al. Suggested age as another significant risk factor, it was not determined to be significant in the study by Wang et al. Wang et al. Found that chemotherapy setting was another significant risk factor for TVAP use. For some background information, adjuvant chemotherapy is given to patients in addition to the initial treatment they receive in order to maximize its effectiveness. TVAPs used in this setting versus non-adjuvant chemotherapy settings had a lower risk of infection. Multiple studies also concluded that sex and site of TVAP insertion were not significant factors. Both Yu et al. And Bassi et al. Determined that mechanical issues in TVAPs were the most common complication that occurred, namely catheter malfunction. Both studies also highlighted infections as a frequent complication. Local infection of the tissue at the site of venous access, as well as catheter-related bloodstream infections, were both present. Catheter obstruction led to vascular complications, including both thrombotic and non-thrombotic occlusion. So an example of non-thrombotic occlusion would be physical distortion of the catheter. All 3 studies outlined previously were conducted retrospectively. As previously mentioned, retrospective studies are often subject to bias. Furthermore, the studies by Yu et al. And Wang et al. Both had significantly lower sample sizes of patients compared to Wang et al. This reduces the statistical power of their findings. Yu et al. Also focused their study on just late complications of TVAP use, which, along with their low sample size, would have further contributed to sampling bias. These studies by Yu et al. And Wang et al. Presented contrasting results regarding the significance of age as a risk factor, with Yu et al. Finding that age was significant and Wang et al. Finding the opposite. Ultimately, there's still uncertainty surrounding this topic. Now that we've discussed the risk factors and complications associated with each device individually, we'll move on to looking at how these 2 devices compare. So for this, I'll be focusing on research by Taxborough et al. And Actor and Lee. Both Taxborough et al. And Actor and Lee concluded similar findings. Catheter type was found to be the most significant risk factor, leading to complications such as thrombosis, occlusion, and mechanical issues. When combining all complications into a composite variable, PICC patients experience significantly higher incidences of complications. They also considered patient satisfaction as an important factor to consider and found a higher level of satisfaction for TVAP users. Thus, it can be concluded that PICCs were found to correlate with higher complication incidence overall. While Taxborough et al. And Actor and Lee concluded similar findings, there were key differences in their studies. Taxborough et al. Conducted a randomized trial, whereas Actor and Lee conducted a retrospective study. Unlike these studies, randomized trials are conducted in environments that can actually reduce selection bias. In the study by Actor and Lee, the results obtained were qualitative as they were unable to make formal statistical comparisons with the PICCs and TVAPs. Additionally, given that it was a single center study, the representativeness of the results obtained is limited. The trial by Taxborough et al. Focused on patients with non-hematological cancer. However, given the study conducted by Wang et al. That I previously discussed, it is unclear whether their findings would be consistent for hematological cancers too. The trial by Taxborough et al. Also included a wide range of different cancer entities receiving adjuvant and palliative care, which limits how applicable their results are to specific treatments and malignancies. For instance, a study by Tang et al. Recommended the use of PICCs for breast cancer patients in need of short-term chemotherapy and TVAPs for long-term chemotherapy. However, in another study conducted by T et al., TUVAPs were identified as the ideal venous access device for patients with thyroid cancer. So this review reveals several potential future areas of research. Firstly, a deeper examination of how age correlates with complications for both of these devices should be conducted. The incidence of complications for both of these devices in adjuvant settings could also be explored, as well as how suitable they are for different types of cancer. Outside the scope of cancer treatments, an investigation into how their risks for other treatments could be carried out. All of this could combine to introduce further research into how PICCs and totally implantable venous access ports can be improved in order to reduce their respective risks and complications overall. This would improve the quality of patient care. So that's it for me. I'm happy to take any questions.
Thank you. Does anyone have any questions? Yes, Senna.
Were there any specific traits, I guess, in these studies that you were looking for when you were conducting your literature review?
I was mainly looking for these studies to focus on trials and experiments that were specific to cancer patients because that's what I wanted to focus my investigation on. And I was looking for, I would say, just a semi-large sample size, but that wasn't necessarily possible for a lot of what I found because there were a limited number of open access research papers available. So I mainly just used what I could find, but tried to limit the variables that were included, I guess.
Great, thank you. And nice presentation.
Thank you.
Any other questions? Me as a question asker. So a challenging aspect about medical research is that we invariably end up looking at averages and following those averages. And so sometimes, or a lot of the times, there are negative outcomes that do accompany them, but we kind of just leave them alone and put them on the side because they're outliers of the process. How could we take that into account in this setting?
Well, I think one of the main things that could be done is a lot more investigation into different variables that contribute to the risks and complications with these devices, because that would rule out any outliers and that would take into account any like statistically significant and insignificant factors that contribute.
Great. And since there's time, one other question. What inspired you to do this project?
So I was interested in conducting a literature review because I was more so interested in learning about specific, I guess, topics and finding future areas of research to look into myself. So I came across the paper by Taxbro et al. Initially, I think, and I was really inspired by, I guess, like how articulate their study was, and I wanted to look into how other, I guess, researchers conducted similar studies, and that led me to this.
Excellent. Well, thank you so much, Tanisa, for your presentation. Very well thought out.